So the question is, are there specific bladder exercises to improve urinary control? Again, the answer to that question is tricky because it depends on what the problem is. So if the problem is that the bladder can't actually hold enough, and so it's the reservoir that's not doing its job of storing, then a combination of behavioral modification, bladder retraining, and medicine will work to improve symptoms. So I'll give you an example. Patient says that they can go for 4 hours with no problem, but when they got to go, and they often don't make it to the bathroom in time. So if you work a patient like that up, it's pretty typical that they get to a full bladder capacity, and when they get full, then their bladder just contracts. The brain has lost to a degree its ability to suppress the reflex. So we learn that as an infant when we're potty trained to suppress the natural reflex. To a degree, some patients lose that for a variety of reasons as we get older or after surgery. Now, you can do behavioral modification to adjust that. And the simple answer is, instead of waiting 4 hours, you go by the clock. So every 3 hours, when the hour hand hits one of the quarters, 12, 3, 6, and 9, you go to the bathroom even though you don't feel like you have to. Why does that work? Simple physics. The bladder never gets full enough to actually be triggered to contract. You're not actually solving the problem. Well, you're not curing the problem, but you're solving the problem by a simple behavioral modification. Unfortunately, we don't actually have a specific exercise that strengthens the muscle. We don't have it, and we don't have a medicine that does that either. We have medicines that will weaken the muscle and relieve the spasms and the unwanted contractions, but we don't have the opposite that has any real value.